healthcare home care coordinator provides a touch point in the clinic for families who have children with special health care needs. I'm Sarah Larson. I'm a care coordinator at CentraCare Women and Children's Pediatrics for our healthcare home program. As a care coordinator, we kind of work with the families, get to know them and their needs for their child, and work with them and their specialists, as well as their primary care provider here in our clinic, and kind of help build a team around the family and support them with making connections to their specialists and scheduling appointments and things like that.
My name is Kelly Meyer. I'm a healthcare home care coordinator for Women's and Children's Pediatrics. A lot of our families who are just starting have just received a diagnosis that their child has special health care needs. So we are able to establish that relationship from the beginning. They can call me with anything and everything, and I can help them with whatever needs come up, and that might be equipment needs, it might be needing to see another specialist or incorporate someone else into their care. And then I'm also making sure that any of those things that are done outside of our clinic are coming back to the provider here, so that their doctor that they see here knows everything that's going on outside of here, and the parents aren't having to be the middleman, so to speak. I think the biggest advantage of a healthcare home would be the continuity, having someone that they can speak to that really knows their child and knows that an ear infection, a fever, or a cough is much more severe for their child than might be for another child that doesn't have their healthcare issues. They're getting prompt care and not having to wait for someone to call them back or speaking with someone who's not as familiar with them.
We discuss insurance coverage at the time of enrollment. Most insurance plans do have coverage for the program, however, each individual plan is always different, and we walk patients through that at the time of enrollment.
Part of healthcare home is also creating a care plan for the patient. So we have a document that allows them to walk into any medical facility and have with them their medical information and what is most important for treatment of the child. For our people that do not have coverage for healthcare home, this is a service that we still provide to them. We start a care plan on the day of enrollment. I do have one family that I work with quite a lot, and it's a cute little guy who has unfortunately had a number of diagnoses that we haven't been able to neatly package into one specific genetic defect. Just having that relationship with someone who knows him, who knows his history, and knows this child inside and out, I think has been invaluable to the family. And so having the availability to have a care coordinator be in healthcare home was really phenomenal, and I think has really changed their lives.
The referral to healthcare home program generally comes from your primary provider. If you're interested or feel that you need help providing care for your child, just have a conversation with your primary doctor and they can hook you up with the care coordinator that's associated through your clinic. And the care coordinator will then meet with you either in the clinic visit or a phone call and discuss with you the program and how you can become enrolled in the healthcare home program.